profile and check their blood test results and their referrals, their notes, because I want to get to know my patients first before I see them, before I talk to them, so that I have already a knowledge or idea on what's currently happening with their, with their health. Hey everyone, welcome back. Welcome back to my diabetes clinic. I'm here in my consulting room. I'm waiting for my first patient, and I'll have a look at my list and see what's happening with my first patient, because I think she is 3 minutes late. And if she is late for 5 minutes, I'm gonna call her just to do a welfare check, just to make sure that she's okay and ask for the reason why she's not able to attend her appointment. So stay with me. So what I usually do is that first thing is I'll check on my clients to see if there's anything newly booked. But on a Friday before my clinic day the next week, the receptionist in the clinic will forward me the list of my patients that I'm going to see on a Monday. And what I usually do before I start is I have a look at the list, see if there's any additional patients in the list. And then I go to their profile and check their blood test results and their referrals, their notes, because I want to get to know my patients first before I see them, before I talk to them, so that I have already a knowledge or idea on what's currently happening with their, with their health. So that's what I'm doing now. My second patient is already here. My second patient is half an hour early. It's very early, which is good. What I'm gonna do now, guys, is I'm just gonna check the blood test reports and see if there's anything else I can pick up when it comes to results, and then I'm gonna call the patients to discuss the results and discuss new management plan on how to improve their diabetes, their sugar level, and their overall general health. So stay with me. I'm just gonna give this patient a call. Okay, no, that's fine. That's fine. How is Petra going these days? Yeah, and can you just confirm with me the medications that she's taking now? Because I know there's some changes with the medication through her GP. So she's taking Jardimet at the moment twice a day, and Opticillin at night. Yeah, Opticillin. Yeah. How is she taking the tablets? Is she alright taking the tablets? She's compliant with it? Yeah. Since the changes with her tablets, with her medication, any improvement with sugars or still the same? We might have to stick with the current medication because it's not really good for the body as well to keep on changing the medication. Okay, we'll give this current medication a chance and a time to work. Okay, and then we'll figure out in the next few weeks if there's any improvement at all. Okay, and then if not, I think it would be better for your mom not to take that much. I think your mom will just be better to take, you know, this newer generation of medications. Okay, so we have a few new medications out there. The ones that your mom currently have, they're not old, but they're not also new, I would say. And because of the advancement of science and technology and the field of medicine, the researchers and the scientists, they keep on researching on new medications, you know, potent and more effective medications. We can talk about it next time, but we'll give this medication a chance because the ones that your mom is currently have, they're actually good medications. Okay, but like what I said, they're not as, you know, they're not new, they're not old, they're not as potent as the new ones that we have these days. Okay. Yeah, so that's good. You know what? They need to be given compliments. Okay, because that means that probably, you know, they're doing something actually good. But at the same time, you also need to tell them that, you know, although, you know, it doesn't mean that your sugar levels are improving. You can indulge yourself with this food that are not really good for your sugar. Okay, because once it goes up, then chances are the doses of the medication will just go up as well, which is not good for the body as well, especially that your mom is already 80 years old. It's not good for her to be taking a lot of medications and high doses of medication. If there's anything that is best for her these days, is to not take that much medication and to just enjoy life. Good. Yep. What we need to do now, regardless of the sugar level that she's having, is to prevent diabetes complications from happening. And what you can do to prevent it from happening is to have her eyes checked on a regular basis, to have her feet checked on a regular basis, and to have her sugar checked on a regular basis. And then we'll take it from there. That is actually good. Yeah? Yeah. I would like to see that one day. Maybe you can record it and show it to me. Oh, there you go. So why not we speak again in 3 months from now, and hopefully after the next blood test, and we'll see how we go. Perfect. All right. Okay. I give my regards to your mom and thank you for your time. I'll speak to you again next time. Okay. Bye bye. All right, guys. There was a follow-up appointment with one of my patients. She's changed her medications a few times because her sugar levels are not that improved. Okay, it's stable. It didn't go worse, but it didn't improve that much as well. So as a result, her medications were modified a few times. Okay, she's on insulin and she's three more tablets for diabetes. So in other words, she's taking 4 medications for her diabetes, and she's already 80 years old. So I was discussing it with her daughter because I think she's Macedonian and her English is not that great. So her daughter was the one translating. I talked to her daughter and said the best way to manage her mother's diabetes, especially that she is now 80 years old, is to actually manage it conservatively. Okay, she needs to enjoy her life. She's 80 years old. Okay, what we need to prevent now is the diabetes complications from happening. Okay, and the ways you could do it is to have all the regular checkup, have her eyes tested at least once or twice a year, have her feet checked at least once a year. Okay, blood test every 3 to 6 months just to make sure that everything is okay, body system is okay, kidneys, liver okay, and sugar levels okay, and see GP every 3 to 6 months just to make sure everything is okay. And then take it from there. I mean, she already knows what to eat, what to avoid. She's physically active. She dances Macedonian dances, so which is really good. And she's not that compliant when it comes to diet. Okay, she knows what to eat. She knows what to avoid. It's just really a matter of doing it. And I do understand. We all have that sort of like personality. We know what to do. We know what is wrong and what is right. but still we keep on doing what is wrong. It's just really a matter of practice. Once she gets into the habit of doing the right thing, and I think if she keeps on doing it, then her sugar levels will keep on improving. So now what I'm going to do is I'm just going to type what we have discussed on the phone, because that will be my consult note. My task now is to write the notes, what we have discussed on the phone, because that will serve as a communication to other health professionals. And also I've ordered some new pathology tests that the patient needs to do in 3 months from now. Let me call my next patient. Have a seat. Okay, here we go. How's English? All right, English?
No.
Not much?
No, not much. Little bit.
But understands.
But understand little bit.
Okay, that's right. I'll be slow. What's the nationality?
Nationality and before and nationality Burma.
Burma.
Maybe, yeah.
Okay. Well, not so much with noodles as well.
Okay.
Noodles and rice will push your sugar levels up. Okay, and then a little bit of exercise that will do. And then, do you want to come closer? So you see that line there? That's the black, and we'll just call it white. All right. I'll see you probably in 3 months from now. Is that okay? Okay. All right. Nice to meet you both.
Yeah, thank you very much.
Thanks, guys.